Can you hear me?
Yes.
Oh, perfect. Thank you. I just wanted to make sure that the sound is working.
That's great. It's very good, very clear.
Pretty good. Okay. You don't want me to make it higher or lower? Or...
I think it's perfect.
Okay. Thank you very much. Thank you. That's all. Can I...
دكتورة نهلة،
كيف
هلا
حالك؟
حياتي، كيف الحال؟ شو أخبارك؟
الحمد لله.
صوتك منور ويغرد يا حبيبتي، بلبل.
شو هو صوتي؟
صوتك.
هلا I want to try if I can put my screen on.
أيوة أنا ما أشوف the camera is not also working here in my side.
وأنا كمان.
مساء الخير يا حبيبي.
أهلين وفا، كيف الحال؟
الحمد لله. الصوت واضح؟
أيوة أول شيء عصرية يعني.
واضح جدا. مساء الخير للجميع، كيفكم؟
مساء النور، كيف الحال دكتورة؟
الحمد لله.
ما عم نشوف صورتك يا وفاء.
ما بعرف، ما عم بيطلع عندي كيف انزل الصورة، لسه ما اعطتني السكرين اكسس.
هذا عشان بس الحلوين
بس لإلي
ما طالع. Kim, I cannot put my video on or whatever.
I think now you can maybe.
Not yet.
I got granted. أول صورة بتشوفونها صورتي.
يا شفنا صورتك مزبوط.
والله.
أنا ويني؟
Kim, access to the camera please.
I really want to see if I can upload my presentation.
هادو أشوفك وفا دكتورة. شوفي.
بس أنا ما
شفتك كمان.
وأنا شفتكم. Miss you girls.
Miss you too. أنا شكلي لازم.
بس أنا ما هحط لأنه لسه جاي من الدوام شكلي يعني شوفي حتى واليوم عيد ميلادي وأنا عم بعطي محاضرة لسه عايشة.
عادي زين، شو يعني بالعكس، يتبارك ميلادك ويتبارك عمرك.
يا عايشة الله يسعدك يا حبيبتي. أنا
عايشة ترفع المعنويات لما بدها.
والله حبيبتي
ولو يا دكتورة دائما.
لأن دائما بدك ليلى كيفك؟
هاي دكتورة، كيف صحتك؟ وينك ما شايفينك؟
ما بعرف ليه ما عم بتحطني، ما بتحبني كم.
لا حرام.
انت she's asking you to join.
بمزح.
شوفي she asked you to join as panelist. كم دكتورة نهلة we cannot see دكتورة نهلة.
لولو كيفك لولو؟ هابي بيرثدي.
هاي ثانك يو حبيبتي، هابي بيرثدي تو يو.
احنا ما نحب الموازين يا
انت البيرثداي يا وفا، البيرثداي جيرل توداي.
بزعل منك عشان احنا اكثر ناس لذيذين.
انت بتعرفي قديش
ومترددين ويعني خليني ساكتة الحين.
Can we test our uploading the screen?
دكتورة ترانا نشوف بس يبهج.
يا رب يا رب.
Okay, sorry to cut you everyone. We will start now. Can I ask everyone to please mute their microphone, and I will move the other speakers to the attendee room. Good afternoon, everyone. On behalf of the Chief Health Treatment Undertaking Services, Professor Aisha and Dr. Leila, the Chair and Co-Chair of Nutrition and Health Symposium, we are pleased to welcome you all to the NHS 2021. In light of the current health situation, NHS will be conducted in series with interactive session virtually. Each series will be accredited by Department of Health with not less than 2 CME hours. We would like to take this opportunity to thank our NHS partner for today for this webinar, Nestlé Middle East. Before we proceed with our webinar for today, please be informed that our DOH, Department of Health, Abu Dhabi, has a new guidelines in receiving your certificate. You will be receiving the link for the PDF step-by-step process in your email by tomorrow. We also would like to invite everyone to please like, share, and subscribe our social media accounts in Facebook, Twitter, Instagram, and LinkedIn for you to follow our upcoming announcements of the upcoming courses. With that, for those who will be unable to join today, we are also simultaneously live through our YouTube account and as well as on our Facebook account. We would like also to request our attendees to please type your questions, comments, or clarifications in the Q&A box down your screen, which will be addressed at the end of today's lecture. Furthermore, we have allowed your microphone to be unmuted to greet our speakers before we start the course. Without further ado, I would like to welcome you to our moderator for today's course, Professor Aisha Al-Dahiri.
Thank you so much, Kim, for the introduction. I'm pleased to moderate the first series of the Nutrition and Health Symposium for today with the great speakers who will tackle on the area of whole grain, their insights and recommendation, their advice in terms of based on the research that has been done with Nestlé team, nutrition team. So the topics that will be discussed today may vary between recommendation, practices in UAE, methodology that will highlight the study that was conducted here in UAE, Fits Kids study. Also, we will tackle on the role of the diet and how the diet and kids can contribute to the kids' health, as well as we will see some international practices in promoting the consumption and intake of whole grain. Without further ado, I would like to welcome our first speaker, Ms. Wafa Aish, who will highlight the role, the whole grain recommendation and policies in the United Arab Emirates. Let me give you some background for our speaker, Wafa Aish. I think all of you know her and you know our other beautiful speakers. Wafa Helmi Aish, she graduated from the Medical Allied Sciences in Yarmouk University in Jordan. And also before that, she has a master's degree in food science and nutrition from Clayton University in USA. Ms. Wafa, currently she is adjunct and advisory board member, as well as part-time lecturer for the College of Health Science, Clinical Nutrition and Dietetic Departments in the University of Sharjah. Ms. Wafa has contributed greatly to the achievement of the Clinical Nutrition Department at the Dubai Health Authority. She has led the place of the policies and procedures of the nutrition while acting as a member in the international accreditation body. Also here, I would like to add one more thing that will highlight an extraordinary day for Wafa, which is today is her birthday. So let's sing for Wafa because of this celebration. Happy birthday to you. Happy birthday to you.
Happy birthday to you. Happy birthday to you. Happy birthday birthday, happy birthday to you. Happy birthday to you.
I think all our audience can sing with us.
Happy birthday, happy birthday, happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Happy birthday to you. Yeah.
Happy birthday, Wafa.
Thank you so much.
I can hear a nice voice from the background, a man who is singing nicely. He should be given a gift for his nice voice.
ثانك يو على هالمفاجأة، ميرسي كتير كتير كتير. أحلى عيد ميلاد بوجودكم. ثانك يو كتير.
الله يسعدك إن شاء الله يا رب.
حبيبتي
The
حبيبتي.
floor is yours, Wafa. I know you will be highlighting several points like food-based dietary guidelines in UAE, as well as whole grain recommendation and policies in the region. And you will tell us more about the development of policies to increase whole grain consumption in the country.
Thank you very much. I'm trying to open my screen. Open my lecture. And 1 second, yes. You can see my lecture?
Yes.
Okay, very good. Thank you, first of all, Tathqif, led by yourself, Dr. Aisha, Dr. Layla, and I'm so honored to be with Dr. Nahla, Dr. Michael, Dr. Huda, and all the team with you beyond this beautiful gathering. And I'm so thankful for this greeting that meant a lot to me. Oh my God, you always surprise me, Aisha. You and Layla, you are tremendously amazing ladies. Thank you very much. Okay, I'm going to talk quickly about the food-based dietary guidelines in UAE. Okay. As we most of us know that this food-based dietary guidelines, they aim to improve the nutritional status of UAE community and raise the awareness about the healthy eating behaviors and lifestyle-related diseases. And they aimed also, when they design it like Burj Khalifa, which we will see very soon, that to reduce the prevalence of the chronic and malnutrition diseases and obesity, diabetes, hypertension, heart diseases, anemia, osteoporosis, and any kind of vitamin deficiencies that exist in UAE. Now, this food guide, what is the food-based dietary guidelines in UAE? It maintained the healthy eating at all stages. They covered in this food-based dietary guidelines. They meant to maintain the healthy eating at all stages of life in reducing the calories by what? By reducing, they did so many protocols in reducing the sugar, fat, especially saturated fats and trans fat. And you can see now, if you go to any market, you can see no trans fat, for example, chips, no trans fat, desserts, no trans fats, cookies, no trans fat. They have done a lot of activities on that. They consume diverse nutrients-rich food and beverages to adopt healthy eating pattern and to replace whatever they have as an unhealthy food with healthy food. This dietary, what is the food-based dietary guidelines? The food-based dietary guidelines, also known in UAE as the dietary guidelines, which are intended to establish a basic of public food and nutrition, health and agriculture policies, and nutrition education, nutrition programs to foster healthy eating habits and lifestyle in United Arab Emirates. There was 5 main dietary guidelines. The first one, which was in the documents, first, to follow healthy eating habits across the lifespan from pregnancy, during nursery, in adolescency, children, adolescent, and adults, and geriatric. So it's all lifestyle. And they put the guidelines to implement it on that. They have focused on variety and nutrient dense and amount. They limited the calorie from added sugar, and you can see a lot of factories, a lot of programs have been communicated with companies, factories that produce beverages, cookies to reduce the sugar and the salt, according to the WHO recommendation. Shift from healthier food beverages to a better choices, and of course, to have a better healthy eating. They have worked on the serving and the portions and how much they should eat. They have explained that, from vegetables, fruits, grains, dairy, as well as proteins, as well as oils, how much each person should take through lifespan according to their age, calorie, and according to their expenditure, their activities as well. Now, there is facts about the food habits, which was published in the Al Bayan journal, and it was done by, again, that food dietary guidelines. It was prepared by the Ministry of Health and Community Protection, and they found out that the UAE daily consumption per capita, of course, of sugary drinks was 1.1 pack. And the guide also indicated that around 40% of the people of UAE society add salt to their diet permanently. And the consumption of this salt products of food, such as processed soup, for example, was 31% of the population. And 33% of this population, the left of the population, they have high salt-rich ready meals because of the pattern of work, because of the pattern of their timings. It differs. They have to take more fast food, and which is rich in salt. And if you see on the right side, you can see how much people, for example, who like 48% of the people, they like to have grilled food, while 56.7% likes to have full fat milk. 33% they like to have those ready salted ready meals. 68%, around 69% around, they like to have more bread and cereals in their breakfast. 45% they like to have meat and chicken, while 82% they take fruits and vegetables less than what is recommended. 82%, imagine, which is very bad. That's why this guide worked on implementing and encouraging healthy eating. 95% who will take good fats, and 5.9 take low-fat food. Now, this pyramid, 18 years between 2000 till 2017 and 2018, especially in the connection of the consumption of fat, salt, and sugar as a substance, they played a very effective role in the health and in the population. And this guide, which again have been done by the Ministry of Health and Community Protection earlier, they did a survey in 2018. And this survey was done on 8,214 participants from all over UAE. And this guide stated that the fat consumption habits of individuals and various groups of the country was high, tremendously high. Olive oil in most or commonly consumed species, followed by sunflower. So first olive oil they take, then sunflower, and then corn oil. And there was an evidence confirmed that high awareness of healthy way of preparation in 48% of the population they use grilled food or less fat food, while 7% they prefer cooked food, and the other 15% they prefer to have fast food and others. Now, the guide also explained that not only its consumption fat via oils, but also other products of individual they consume on daily basis, including cheese, with average of 38.8%, white cheese, 17% consumed cheese, which cream cheese, and yellow cheese was around 15.6%, and only 5.9% will go for low-fat cheese. And the guide also indicated that 40.6% of the people in UAE, as I said, they take more salt in their diet permanently. Now, bread and cereals in breakfast, there was an evidence shows that in morning they consume good breakfast cereals, around 68.8%, while the selection of meat groups who will take like mortadella or they will take sausages, it's around 45%, followed by fish and then red meat. Fruits and vegetables, as I said, around 82% less they are using. Does UAE import wheat? Post estimate UAE all wheat import wheat flours, pasta or couscous from February June 2019 will range around 750,000 to 850,000 tons around, which total combined wheat importance. And why we talk about it? Because we talk about grains, and that grains or whole grains should be around 55% of the total calorie which you should take. So this indication of import of grains or wheat shows that we really take good care of importing them and using them. And this statistics, which have been done in UAE, Saudi Arabia, Lebanon, and Kuwait, showed that children who eat breakfast regularly have a more balanced diet, including more fruits and more milk and healthier lifestyle than those who skipped breakfast. In addition, in this research, which have been done in 2008 and 2009, as well as it went to 2014, that in addition, research shows that children who skip breakfast may not make up their nutrients, which was missed in the other meals which they take during the day. And this percentage usually of children who doesn't consume breakfast regularly on daily basis, it have affected them even in obesity and their way of lifestyle. Now, did you know that 80% of the individuals in UAE and Saudi Arabia think it's important to eat whole grain, but 86% don't know how many grams that should be eaten every day. That's why we should, as a clinical dietitians, nutritionists, to see this gap and fill it by education about whole grains and why we should take whole grains and how we take these whole grains in our daily food. More than half of them, they think they had enough whole grain, but it is not truly the amount that it is taken. They think they did, but honestly, they don't know how much they have taken from this whole grain. Now, in UAE, we know that we have grains in so many food. Examples of that, they have the Arabic chicken haris, where they add the wheat in that, and the barley, as well as in the mutton haris, lahm, and you can see that it contributes significantly in their tradition, and we have it in so many types as well. But the major and the famous ones are the haris, which is very common. And we all know that haris, one serving contains around 11.1 grams of total carb. And the net from carbs is around 9 grams and proteins around 3.3, while it gives you around, in this serving, around 81 calories. But do you know how much grains in that? Did you know how much you have whole grain? This what we should concentrate in the future about. What about the examples, successful examples that have been done earlier when I was in the, when I was a director of clinical nutrition? We had a lot of services educating people and consumer and awareness campaign in UAE about having vegetables, having whole grain, encouraging healthy eating by having the My Plate and Healthy Plate, whether for public, as you can see in the pictures, or for students. And we even went on the first right one, it's in the nurseries. So we went in KGs from nurseries up to the adults. We covered all the lifespan in educating people. I can show you another pictures of a successful, we went into the smart shoppers and smart shopping in the markets, the hypermarkets, to educate them how to eat healthy. We went even into where there is, you know, like marathons, to educate them how to be healthy with exercise. We even brought some chefs to teach them how to do a very tasty, healthy, rich in fiber, grains, and vitamins and micronutrients. As you can see on the left side, the bottom one, this is a live cooking for the people with the live chef to show them how beautiful and tasty is the healthy eating. Not as people think when you go for a diet, you have to eat yucky food that doesn't have any taste. No, you can have still high fiber, high rich food with rich grains and rich fibers, and still good, look good, and as well taste good. Here as well, we did in the an education, we did a competition. We gave the children the list to choose what they in the trolley, and we divided the trolleys, small trolleys for them. That goes, we call this initiative as a Captain Nutrition, and we gave them this, their own list. They wrote it, and we give them the trolley that have divided according to the pyramid, grains, fruits, proteins, dairy, and fats. And we gave them coupons to go for the market. We took around in Carrefour, and we covered a lot. In the upper one, we did a competition in the schools. These children in the school, they went themselves to the supermarket, and then they went home. They cooked food and they brought it the second day. As you can see, this is their own preparation with a very beautiful ideas. This is their own preparation, by the way. And you will not believe these children. They cooked themselves with their parents. They showed them how to do the recipe. They selected the items from the market, and they went and they implemented that. This is one of the schools in Dubai, which we did in 2019, and it was very successful. This is a dinner, by the way. You can see this dinner prepared by students in grade 6 till grade 8. And you can see that on the right side, it's a very healthy breakfast that the child himself selected, and he chose to have this kind of breakfast. In that, I end my talk. I hope our initiatives will give you a little bit. This pyramid, these guidelines, which have been prepared by the Ministry of Health and Protection, which indicated Burj Khalifa, have shown that they selected that pyramid, that Burj Khalifa, to show how we can implement the pyramid or the healthy plate or whatever kind, or the qubba or whatever kind of food in a good way in our system. Thank you very much, Dr. Aisha, and I'm ready if there's any kind of questions.
Thank you, Wafa. Thank you for the lovely introduction for the practices and recommendation for the consumption of whole grain. in UAE. I would like, if you don't mind, and our other guests to leave the discussion till the end, to move on with our program. But let me first thank Nestle Middle East for partnership, for their partner with the Tazqif to deliver the Nutrition Health Symposium series. And I would like to welcome Sarah Kanaan and Karine Antoniadis to this session because they are attending also. Now let us move to the Fit Kids, and I'm not sure if you have heard about this interesting study which was conducted last year. It was finished, I think, or early this year, about Fit Kids in the United Arab Emirates. So Dr. Leila Sheikh Ismail, she will highlight the methodology of Fit Kids study, which was conducted in UAE, and later on we will hear about one of the outcomes of this by Professor Nahla Hwalla. Before we start with Dr. Leila, I would like, of course, to introduce Dr. Leila to the audience. Dr. Leila holds a PhD in nutrition, and she is also a registered nutritionist with the UK Association for Nutrition. Dr. Leila has more than 15 years of international experience with WHO, IEA, and also Oxford University. At Oxford University, she led the Intergrowth 21st project for almost 9 years. And then, alhamdulillah, we welcome her here in UAE, and not at UAE University, unfortunately, but at the University of Sharjah, our sister university. So she is currently working in as an associate professor at the nutrition department in University of Sharjah. Let us welcome Dr. Leila. Dr. Leila, please, you have 10 minutes only.
Thank you. You are my friend. You can give me some more.
Sorry.
Okay, you start when I share my screen, please.
Yalla.
Okay, can you see my presentation?
Yes.
Okay,
go ahead.
I need to hide this. I don't know how. I don't know how to
All
hide.
from your time, Habibti, Dr. Leila.
Okay, but I don't know how to remove the. I cannot see my, okay, one second, okay. Great, can you see? Okay.
Yes, go ahead.
Okay. Okay, so thank you so much, Dr. Aisha, thank you, Tazqif, thank you, Nestle, and I'm very pleased to be here talking about the methodology of the Fit Kids study in the United Arab Emirates and how we made it happen. We are all, as you can see, one team working together, and we are still working together for this successful project. What is Fit Kids? It's a survey of nutritional status of children from 0 to 13 years. It's really, we took a representative sample from the United Arab Emirates with the objective of assessing the nutritional status, dietary, anthropometry, and lifestyle in infant and children from 0 to 13 years in the United Arab Emirates, with the aim for the development of evidence-based interventions, formulation of health-related policy to enhance the availability and access to healthy diet in early life for later, better life. This project was done in collaboration with different institutions, as you can see. And, it's a collaboration between United Arab Emirates University, Tazqif Undertaking Services, and University of Sharjah here in the United Arab Emirates were responsible for the study adaptation, implementation, data collection, and also now working on publication and dissemination like what we are doing here. This was done in partnership. Cannot change. This was done in partnership with the American University of Beirut, and we were responsible for the regional design, publication, and dissemination, and for sure all the taking of this project. And this was not going to happen without the funding of Nestle institution in Switzerland and also the MENA office here, and who developed the original methodology, like global methodology for the Fit Kids study. And now we are all working together on that dissemination. So as I said, we had the UAUB team and UAE team, EUB team, led by our professor, Professor Nahla Hwalla, who really was not only the leader at American University of Beirut, but she was the leader and still the leader for the whole project. And for all of us, we are very happy to have you here with us live, Dr. Nahla. And also from here, Professor Aisha Al-Dahiri from United Arab Emirates University, Dr. Wafa Aish, and also Dr. Habiba Ali. And Ustaz Khif was responsible for the implementation and all the logistics. And as you can see, also we had a big team from American University of Beirut, Dr. Farah Naja, Lara Nasruddin, Samir Karoubi, and Sarah Ibrahim. Before we started the project, we had to get ethical approval, and we took 6 ethical approval from all the universities and also from the Ministry of Health and Ministry of Education and from Dubai Health Authority. It's important to mention that including the PI, all the research assistant, we all really attended online training, protecting human research practices online training. The study was done in the 3 main biggest emirates of the United Arab Emirates, Dubai, Abu Dhabi, and Sharjah, with the aim of continuing for the Northern Emirates, inshallah, in the near future, after we finish from the COVID period. The aim was to collect 1,230 sample like a population, and we were able to collect, as you can see, 1,215, and I will say this later with the challenges because of the COVID, but almost we collected all our samples. The study was conducted and the recruitment was done in nurseries, hospital, schools, and also primary health care centers, depend on the age of the children, 0 to 4 in hospital and nurseries, primary health care center, and children from nurseries and school. And here you can see our research assistant taking the length of the child, and another one interviewing the mother for the eating habit and physical activity of the child. The inclusion criteria was age less than 13 years or equal 13 years, absence of chronic diseases, inborn error of metabolism, physical malformation. And also born at term, we did not include any preterm baby, and singleton, no twins, no triplets, okay? And exclusion is the opposite. However, we did not include any Arab who did not live in the United Arab Emirates for more than 3 years because they still did not get the cultural adaptation. The survey was based, as I said, on the global Fit Kids, and that was adopted to the region, MENA region, and also to UAE. And it included different components: socio-demographic, behavior, physical, and meal pattern and feeding practices. It was based on literature review, and it was age-specific because the feeding is different, physical activity is different between 0 to 2, 2 to 4, and 4 to 30. The survey had different components. As I said, it covered child characteristic, physical activity, dietary intake, socio-demographic, and anthropometry. I'm going to speak little about each one as I have very time limit. So child characteristic including motor development, like sitting without support, walking without support, standing without support, attending daycare, nursery, or school, food allergy, consuming fortified food. Physical activity, we had done a physical activity questionnaire for greater than 4, and this is a screenshot of it, part of it, let's say, like playing, reading, sleeping, and all this, hours of sleeping, of nap, and screen time was very important at this age. Dietary, it included 24-hour dietary recall, feeding practices, and also 24-hour recall, and also eating environment, like eating with the family, eating on the TV, eating alone, eating outside. And it's important, again, this is a big achievement that we managed, despite everything, to take a 24-hour recall from half of our samples. Socio-demographic included parent educational level, parent type of work, number of adults, number of car, and monthly income. Anthropometric measurements, we included weight, length, head circumference, mid upper arm circumference, waist circumference for the child, and for the mother we took height and weight. It's important to mention that we used robust equipment. It was standardized across site, similar protocol across site, and it was portable, as you can see here. This is the case or the bag. We was able to take our equipment, use it, and then put it back and take it to another place. The interview was mainly conducted with the mother or the caregiver, depend, maybe the grandmother, maybe the father, maybe the auntie, depends, but mainly the mother, especially for the children less than 9 years, then with the children in the presence of the caregiver after 9 years, and the babysitter or the nanny was also included if needed, if the mother did not know about what her child ate the day before or the practices of that child. The questions were entered on the question applications are developed for this FITSKIDS study on the app. And then the 24-hour report was entered on the NutriPro software. Like any other study, for sure we face some challenges. We have the success of it, but still we face some challenges. Most of it, the internal ethical, first the ethical approval, 6 as you can see, but still after that, to each school, to each hospital, we entered Earth Nursery, we had to get internal approval, and this for sure delayed the data collection. Technical difficulties, little bit with the new app, the new application question at the beginning, but then we overcome this. Low response rate from nurseries and school because parents there were very busy, or they didn't come, or the children used to go sometime with the driver, sometime with the parents. Dropout from the study was very low, but still we had some people didn't want to do it. And at the end, toward the end, we were very lucky of the data collection. COVID started, so we did not affect us much. This was we are lucky, not lucky that COVID started. And then, so we had some lockdown in some area, and then after that, all the nursery and school were closed. So the study started, as you can see, in 2018, and we until now. So we started with ethical approval and the training 1 year, and then 1 year data collection. As you can see, 2020, toward the beginning of COVID, we were almost finishing our data collection, and now we are working on data analysis, manuscript, and today we had a gift, like one of our manuscript is almost accepted. We have to address the reviewers' comment, and also presenting like such event on nice platform to disseminate the result of our study. Here, I would like to finish and say I cannot, this was not going to be done except with just collaboration. As you see, we are all here together today, Nestle, EUB, and also all the universities. We all work together, some consultants also, but the most important is the authorities and our research assistant and project coordinator, Dr. Maysam Mohammed, and some of the research assistants still now working with us on the manuscript, like say Masaleh, Ramiz Ad-Da'ur, Radia, Rajabi. They are still with us working, and without them, this job was not going to be achieved. Thank you very much. I hope I will stick to the time, Dr. Aisha.
I'm very happy, Doctora. You did
Thank
it
you so much.
Still you have 40 seconds.
Okay, thank you. I hope you have enjoyed it. And you know, a little bit, we always like to speak about the methodology because it's important for our audience to know how did we really achieve this good quality result. Thank you so much.
Yeah, I enjoyed also your slides. They look really nice and neat. Thank you
so much. Thank you so much.
And of course, what Dr. Leila did, she presented the methodology, and now Dr. Nahla, she will highlight one of the outcomes or the result of the same study, and mainly the focus will be on the consumption of breakfast, whole grain, and fiber intake. But before she tackled this, she reached the result of the study Fit Kids, she will highlight the association between whole grain and the risk for non-communicable diseases. And also she will give us a highlight on the intake of whole grain in the region, because Dr. Nahla, she comes from the American University of Beirut, and she's part of the region. So let me introduce Professor Nahla Hwalla to you, as I did for Ms. Wafa and Dr. Leila. Of course, Dr. Nahla, I like to introduce Dr. Nahla because she is the one behind the nutrition field in this region. Really, she is the flagship of the nutrition field. Professor Nahla, of course, she's a professor of human nutrition at American University of Beirut. She served as dean for the College of Agriculture and Food Science for almost 11 years. She's the founder and also president of the Lebanese Academy of Nutrition and Dietetics. She has more than 140 articles in nutrition and diet-related diseases. As I mentioned, she is the one behind the nutrition field in the region. Dr. Nahla, she received many awards, but I cannot list all of them, just to acknowledge her contribution to the science and to the field of the nutrition. One of them, the latest one, was the Medallion Award from the USA Embassy of Nutrition and Dietetics, sorry, not embassy, but Academy of Nutrition and Dietetics in 2019. Let us welcome Professor Nahla Hwalla. Doctora, the floor is yours. She will highlight, as I said, the whole grain role in the diet, as well as the outcomes from the kids study.
Thank you, Aisha. Can you hear me?
Yes, we can hear you.
Thank you. First of all, I'm really very proud that you, Aisha, and many of the graduates of the UAE, this is a program that I have established, and I feel more proud now having people like you at the helm of nutrition in that part of the world. So congratulations on all your achievements, and thank you very much for this very complimenting. You humbled me with this introduction. I'm going to share my screen now and start my presentation. Can you see my presentation? Can you see my screen?
Doctora, if you can, if you can put it as presenting slide, it will be good, so we can view.
I'm putting it as share screen. Okay. Now?
Yes, Doctora. You have 20 minutes, Doctora.
Okay, so you can see my screen now.
Yes, we can see.
Okay. So thank you, Aisha, again. My presentation today about whole grain, fiber, and breakfast skipping from the FITS-KIDS study. But as Dr. Aisha mentioned, I will just make some introduction on the contribution of these food groups to our diet in this part of the world, and also the contribution of these food groups to our protection from non-communicable diseases. So why whole grains and the fibers and breakfast skipping? Because these, the low consumption of whole grains and the low consumption of fiber and skipping breakfast are associated with many of our Middle East and North Africa health problems, such as obesity, diabetes, cancer, mortality, and cardiovascular diseases. What are examples of whole grains? They actually go into many of our foods, such as our bread, it's corn, it's burgol, it's buckwheat, it's wild rice or brown rice, and oats and rye are all components of the whole grain group. What is the difference? Why do we emphasize whole grains? We eat a lot of grains, but we eat a lot of refined grains, which you see on the right of the screen. And as you can see that the refined grain doesn't have the vitamins, the phytochemicals, the healthy fat that are present in the whole grain, and they are removed in the processing of the refined grains. So what is the relationship I need to prove to you before I recommend the whole grains is that there is a relationship between whole grains and non-communicable diseases from the many, many studies that have been conducted worldwide. So the people that eat whole grains, they can reduce their risk of diabetes, they can reduce the risk of heart disease, cancers, and the risk of stroke by 20 to 40%, which is quite a huge percentage. And if we look at this study from the British Medical Journal, you can see that 90 grams per day of whole grains will lower heart disease by 19%, 1/4 almost, 12% stroke and 22% risk. And here, let me introduce you to the three graphs. Whatever you see squares on the left, it means it decreases. And if you see them on the right, the squares, it means it increases. And you can see here that the relative risk of coronary heart disease, stroke, and cardiovascular diseases, all the squares are on the left, which means there is a decrease in 22 in these percentages from the many, many studies that you see in front of you, and it's not one study only. Also, the intake of whole grains will lower the risk of obesity and overweight by almost 15%. And you can see also here the squares are on the left of the line, which means a decrease of around 15%. Whole grains lower metabolic syndrome, which predisposes people to diabetes by 20%. And the predominant studies have shown that it will decrease it, and the squares are more to the left than to the right. Also, whole grains have been shown to lower colorectal cancer risk. And you can see from this slide that as the whole grain intake increases in this graph, the relative risk decreases. And this is for about 20%. So this is for whole grains. And I said I will show you data for the three of them. What about fibers and NCD? Actually, fiber follows what we have said about whole grains. And here you can see that all-cause mortality decreases by 16%. You can see that all the squares are on the left, and the many studies that showed that it will decrease mortality. It will decrease obesity, it decreases BMI, body weight, and body fat. And this is also shown in the meta-analysis of the studies on your right. It will also decrease metabolic syndrome similar to whole grains by 30%. And this is obvious in the slide I am showing you here, and the many studies that all showed a decrease in metabolic syndrome due to fiber. And a decrease in ovarian cancer of 22% have been shown with intake of dietary fiber. So what about skipping breakfast and non-communicable diseases? I am not going to dwell much on this, but I can tell you that skipping breakfast will increase the risk of overweight and obesity by 44%. And here you see a different picture where all the squares are on the right, which means increase the risk of obesity. Skipping breakfast will increase the risk of cardiovascular diseases, and the squares are also on the right, and it increases it by 21%. And globally, there has been a tremendous, huge study by the Global Burden of Disease that has shown that diets that are low in whole grains, that are low in fiber and low in fruits and vegetables, they increase mortality rate. And if you look on your left in the gray, you can see that diets low in whole grains occupy a prominent position in increasing mortality. And also the working days of people are decreased, and number one contributing factor in this slide shows you that whole grains at the far left contribute most to absences and to disability in people, and to working days, healthy working days. So a diet which is low in whole grains, as you can see, and low in fruits next to it, and low in vegetables also, and low in fiber, all decreases the healthy life of people. So what about our region? And as we promised in our region, we will talk about the region in general and about the FIT study and the results of the FIT study. In the MENA region, this is also a study that was done on 22 Arab countries. And if you look at this slide, and you can see at the top, suboptimal diet and low whole grains have been a huge contributing factor to coronary heart disease, ischemic stroke, hemorrhagic stroke, other cardiovascular diseases, and diabetes. So these items in the diet have been shown to be contributing to these diseases. And if you look at this slide and you look at whole grains in those 22 Arab countries, and they include UAE, and you can see that the consumption of whole grains and the red line is what people should be consuming. You can see that the consumption of whole grains is very, very low, and this is in adult populations. So none of our countries really consume the right amount of whole grains. Others from FAO, from WHO, this is for fiber. The intake of children is inadequate in the MENA region, and you can see here that this is in 2020 by Dr. Al-Jawaldi, and dietary fiber intake is lower than the red line, which is 25 grams per day. However, our countries consume around 11 to 18, depending on the country. So in FITS Kids study, we have looked at whole grains, fiber consumption, and breakfast consumption. And we used the recommended intake that were provided by many international agencies. And if you look at those agencies, you will see that about 180 grams is the recommendation, 6 ounces of grains per day. And most of the recommendations until 2020 were half of those should come from whole grains, which is about 90 grams. However, the Eat Lancet publication, the most recent one, they recommend that all of them should come from whole grains, and not half of our grains should come from whole grains. Fiber intake, in general, it's 25 grams per day, but this is the figure I chose for women. For men, it is much higher than this, but women is my priority. So all children consume grains and grain products in UAE. This is from the study of the FITS study. And if you look at the slide on the left, actually, Wafa gave a figure of about 80. This figure is in children, and in children, it's about 99. Almost all of them consume grains and whole grains. And the amount is also adequate. It is within recommendations of 200 grams intake of grains. However, these are grains, and to illustrate that this is not whole grains, we looked into the whole grain intake, and you can see that only 7% of UAE children consume whole grains. So the consumption of whole grains is very, very low in this population. Fiber intake is also 11, which is below the 25 that is recommended. And so fiber intake in the FITS study was also low. Now, for the fiber, if you look at this slide, this is consumption of foods that are known to have high fiber content. And if you look at this slide, you can see that in the blue are the people that are not adhering to recommendations. And as Dr. Aish mentioned, the consumption of fruits and vegetables is very low, because about 90% of the people do not consume the required amount. Whereas if you see the grains, it seems that only 30% of the people do not consume enough grains. But still, this is refined grains and not whole grains. Skipping breakfast, luckily, the FITS showed that children in UAE do not skip breakfast. Actually, only 3% approximately of the children skip breakfast. This is great news, because this gives us the chance to introduce the whole grains in the meal that is consumed most, which is in the breakfast. So if they consume breakfast, this is where we need to interfere. So whole grains in the breakfast, the percent consuming whole grains is 2%, 2.6%, which is very low. So intervention at that level is extremely recommended. So key findings of my presentation and of the study is that low whole grains and low fiber are most contributing factors to non-communicable diseases. Whole grains and fiber consumption in UAE children, both are low. Vegetables and fruits that contribute to the fiber intake is also low in UAE children. Breakfast is a good occasion and opportunity to increase whole grains and fiber intake for UAE children. So the take-home messages is select all your grains as whole grains and not only half of them. Increase whole grains food during breakfast because everybody eats breakfast, it seems, at UAE. Increase fiber intake by increasing also fruits and vegetables and whole grains. Whole grains also contribute to fiber intake. What can be done? There are so many things to be done in order to promote it. And of course, Dr. Aish mentioned this, and I repeat, many countries have used a whole grain stamp to encourage people to see where whole grains are available. And there are many other options. There is taxation on refined grains. There is fortifying with whole grains. There is biscuits with a label that says it is made of completely or half from whole grains. So make all your grains whole grains. And if you look at this very tempting breakfast, I want you to tell me, Aisha, what's wrong with this breakfast?
White bread.
White bread, absolutely. That's the star. That's the star.
طيب يا دكتورة.
Thank you. Thank you very much.
Thank you so much, Professor Nahla. It was really nice to highlight the outcomes from the FITS Kids study, especially when it comes to skipping breakfast, the consumption of whole grain, fiber, and how beautiful we can see that most of the kids, 99% of them, they consume breakfast. So if we need to intervene, then this is the here where we can intervene. To know more about the experience, the international experience, I welcome Ms. AJ Dorokan, who will highlight the international experience in terms of intervention, initiatives, and actions for the whole grain involvement in the healthy lifestyle of kids. Also, she will give us some evidence-based information to inform the policymakers and the best way to increase the consumption of the whole grain among the population. First of all, let me introduce Ms. AJ Dorokan. She is the head of the Global Nutrition Regulatory and Scientific Affairs at the Cereal Partner Worldwide. She is the maker of Nestle breakfast cereal, and she's located, of course, in Nestle, Switzerland. She's leading the many activities such as advocacy for the policymakers, driving the nutrition and health vision for the different categories, sharing the latest science on nutrition for the healthcare professionals, and also highlighting the health benefits of consuming whole grains. So mostly she tried with the science to inform the policymaker and try to take a great opinion from the leaders to contribute to a healthier lifestyle for the population. Of course, she's a member of Turkish and European Dietitian Association. Let's welcome Ms. EJ, who will highlight the whole grain. She called her session taking whole grains seriously. This is what I like about it. So mostly she will highlight the international experience and intervention that we can replicate here in UAE. The floor is yours.
Thank you very much, Professor Aisha. It's great to see familiar faces and familiar names. And today I have the pleasure to take the opportunity to give you an overview on the global initiatives that aims to promote whole grain consumption worldwide. I hope the examples I will share will provide you some inspiration and equip you with some tools to drive actions in the Middle East as well. So I'm sharing my screen. Can you see my screen?
Yes, yes, we can see it.
Okay, perfect. So my session's name is really taking whole grain seriously, because we think that it's the time to take actions to promote whole grain intakes worldwide. Professor Nalla Valla shared a lot of scientific facts why it's important for health, but I also want to start my presentation to share our company purpose, to give it a bit of context why we are so passionate about the promotion of whole grains. At Cereal Partners Worldwide, we are the maker of Nestle breakfast cereals, and all our promise is about making breakfast better, because all our products are designed for breakfast occasion. So we are bringing this company purpose to life through 3 pillars of promises: better food, better lives, and better planet. When we look at 3 pillars, of course, we are committed to nutritionally improve our portfolio over time and provide the most nutritious options to our consumers. And whole grain is definitely playing an important role here. For the better lives, we promise to build local communities through the power of breakfast. We know that in long term, whole grain intakes are associated with the reduced health risk of non-communicable diseases. So we believe whole grain also takes a big role on providing better lives to the populations we offer our products. And Better Planet Promise is all about making breakfast while creating a positive impact on the world around us. And based on Eat Lancet report, we see the importance of whole grain intakes in the context of sustainable diets as well. So whole grain is mainly embedded on the better food part. And if we really take a better focus on what we have achieved so far, we made whole grain as the #1 ingredient in as many of our cereals as possible. And we continue to advocate for policies that can help increase whole grain consumption in different countries. Today, 90% of our total portfolio and 99% of children and teens products have whole grain as #1 ingredient. I think this is quite important to install the eating habit of whole grains at early childhood. It starts with providing tasty and healthy options for kids in order to increase their consumption. So we are quite proud of what we have achieved, especially for the children and teens products. Beyond fixing or improving the product reality, we are keen to build partnerships with credible third parties to promote the importance of whole grain, and of course encourage the establishment of relevant policies and regulations that I will take you through shortly. So I won't go into the details on why whole grains are good for health and for the planet, because I think Dr. Valla shared a lot of great examples and scientific studies to prove that already. But on the Global Burden of Diseases report, I would like to share a very striking headline covered by CNN. While they're sharing this Global Burden of Diseases report, they said, "What we aren't eating is killing us." It's really true. Like when we look at the report results, low whole grain intakes are one of the top 3 diet-related health risks to drive mortality. So when we look at the national policies, we are really very much focused on the public health sensitive nutrients, such as sugar intakes, sodium intakes, which are equally important, but we shouldn't underestimate the power of positive nutrients that can make a big change. And on the Eat Lancet report, we see that the global average of whole grain intake is really far from what's recommended in a planetary health diet. Unfortunately, consumption levels are quite low across different countries, including UAE, based on the Fits and Kids study results. Credible stakeholders are really endorsing the benefits of whole grain benefits. I share a couple of examples here. For example, in 2020, joint fact sheet was published with European Heart Network and Heart Community on whole grain and cardiovascular health. And they raised an important communication why whole grain consumption should be promoted to prevent cardiovascular diseases. FAO and WHO acknowledged the importance of whole grain intakes in balanced diets in the fight against COVID-19 in order to support the immune systems during this pandemic. European Beating Cancer program is one of the top priorities of Europe, and there they acknowledge the importance of whole grain intakes in correlation with the reduced risk for colorectal cancers. So all these credible stakeholders are creating an awareness on the importance of whole grain intakes, which is really great. However, the actual consumption levels are remaining concerningly low. When we look at different countries, unfortunately, we see the intake levels as low as 9 grams only, where the recommended intake is 48 grams based on US dietary guidelines. We see an amazing increase in Denmark, thanks to the public-private partnership, which is a great example. And I think that it helped Denmark to be to hit the world record with the whole grain consumption. And today they reached to 82 grams whole grain consumption per day. And I will touch base on it a little bit to share some inspiration on this public-private partnership as well. So we can promote the intakes of whole grain in collaboration. I think we have an important role to play, and also policy influencers and consumer influencers have an important role to play along with the industry. Through policy influencers, we are keen to open up conversations in order to harmonize whole grain regulations, because today there is no regulation in many of the countries to be able to make whole grain claims on the products. It's very important for us as well to get the well-deserved recognition on our efforts to make whole grain #1 ingredient across our portfolio. It's important to come up with whole grain quantitative recommendation in dietary guidelines, because it will really help people to understand how much whole grain they need to consume to be able to get all the health benefits or planetary diet benefits that we are listing. Consumer influencers are playing an important role, and with consumer influencers, I mean dietitians, nutritionists, nutrition and health associations, because we need to ignite a whole grain trend. We need to spread the word about the goodness of whole grain. Today, consumers think that it's good, it's a very beneficial ingredient, but they don't actually know what it helps for. They don't have any clue that it's such a strong ally in the fight against non-communicable diseases. So we need to collaborate to really spread the goodness of whole grain and create more awareness in order to generate demand for whole grain food. So with all these objectives and ambitions in mind, we have collaborated on Whole Grain Initiative platform. This platform was built back in 2017 with the lead of ICC, the International Cereal Chemists Association. We have organized the Whole Grain Summit, inviting all the key opinion leaders from all around the world to discuss how we can increase whole grain intakes globally. And there we published a declaration and built this Whole Grain Initiative platform in collaboration with policy and decision makers, health organizations, donor organizations, and also private sector. So the intention is really to increase whole grain intake globally, and today more than 100 stakeholders are collaborating towards the same goal. You see some of the members on the slides, like Whole Grains Council, Grains and Legumes Nutrition Council from Australia, European stakeholders like European Cancer Leagues, Health Grain Forum are some of the stakeholders that takes part in order to build science, build advocacy tools, and build education campaigns in order to promote intakes in different countries. So back in 2017, we decided to build working groups consist of different experts, again, from all around the world. And we have built 5 working groups. The first one was focusing on whole grain definitions, because we were lacking a global consensus on whole grain definition. And it was the first question when we approach governments or when we approach nutrition and health associations to promote whole grain intakes. Of course, everybody was asking, so what's whole grain? And we really desire to have a global consensus so that we can initiate conversations based on this. And it was delivered. The other group is on the economic evaluation of increased whole grain intake. So it's focused more on the health economics perspective of whole grain intakes. Another group is working on the best practices for public-private partnerships and communication. One group is focused on sustainability of whole grains, and another group is focused on food policies related to whole grain, including front of pack labels, including the integration of whole grain into national health strategies. So all these working groups are delivering advocacy tools for all countries that are interested to include whole grain in their national guidelines, national health strategies, and to make a change on the nutrition and health status of their population through whole grain intakes. So I will just share a couple of deliverables from these working groups, and you will be able to find more of those in the Whole Grain Initiative platform.org. The first deliverable is, as I said, whole grain and whole grain food definitions. So it's not always defined in regulations, and in the absence of definition, the communication is really confusing and potentially misleading. We need to provide a certain amount of whole grain to be able to deliver the health benefits of whole grain through products. So we need to come up with certain thresholds to ensure that we are delivering the right amount. Today, although you have 1% whole grain in your product, you are eligible to make whole grain product claim. So it might be misleading for the consumers. That's why we wanted to harmonize these thresholds for all industries' use. First, we defined the whole grains as food ingredient. I won't go into the details, but it's a very comprehensive food ingredient definition with some technical aspects so that all suppliers, all food industry or health professionals can go through and have an idea in which circumstances the product can be called as whole grain. It's also important how to communicate on whole grain on front of pack, what should be the minimum amount to be true to consumers' expectations and to health benefits. So as a result of these questions, we came up with the whole grain food definition. So a whole grain food shall contain at least 50% of whole grain ingredients based on dry weight. We focused on dry weight because there are many different types of products that can be in liquid form, that can be as porridge, where the liquid part is quite high. So we really focused on the dry weight of the product. And as the second stream of this definition, to be able to carry a whole grain claim, the requirement is having minimum of 25% of whole grain ingredients, again, based on dry weights. So this is the consensus all the experts reached to. And we came up with this two-level approach. Of course, if there is a regulation at a local level in the country, the regulations takes precedence. But whenever it's not regulated, the aim of this whole grain food definition is to set a standard to really meet the consumers' expectations and to deliver a meaningful amount to consumers. And again, when we look at Nestle breakfast cereals portfolio, since 2003, we have been increasing our whole grain intakes, and to be able to translate it into consumer communication, we are referring to our green banner with some conditions of use. So our green banner means we are targeting minimum of 26.7% whole grain in our products at the minimum. And also it's coming along with no artificial colors and flavors promise. Moving into public-private partnerships, which is very important to create awareness and ultimately promote the intakes, it really helps to solidify a strong whole grain identity and voice. The intention is increasing whole grain consumption in the countries, and it really enables a regulatory environment, a communication environment to really increase awareness among consumers. So it consists of communication, outreach, events, regulatory, some food policies that is really promoting the whole grain intakes, helps it easy for consumers to find, and finally build a whole grain narrative around the positive benefits of this ingredient and dispel whole grain myths as well. So one important example is Denmark example. You have seen how significantly they increased the daily consumption of whole grain. And thanks to this vision they set up in early 2000s, they built this partnership together with private sector, but also public institutions in order to create an environment that promotes whole grain intakes through logos, through industry initiatives, and through communication campaigns. In 2009, you see here in Denmark, the carbohydrate sources was significantly attacked by the Atkins diet hype at this time. So the Danish whole grain campaign started to address this concern and really stop the negative impact of Atkins diet hype in the country. And they really promoted the difference in between high quality carbohydrates versus refined carbohydrates. They already came up with the ambition to have 25 grams per day consumption recommendation on whole grains, but today they are even above that. So they brought commercial partners and Danish Food Administration and health NGOs, and they built this collaboration in order to make a change, and they did it successfully. So I think this template of collaboration shows the power of Denmark that ultimately ended up with amazing results on the daily consumption. Last but not least, I would like to give heads up on the International Whole Grain Day, which is also a deliverable from the Public-Private Partnership and Communications Working Group of Whole Grain Initiative Platform. International Whole Grain Day was launched back in 2019. And this year we will be celebrating the 3rd edition on the 16th of November. Of course, all the participants to this webinar is invited to join the celebration. This year's theme is "It's time to act for you and for the planet through whole grains." We have a very strong agenda to discuss the best practices, and we have important keynote speakers. Dr. Francesco Branca from World Health Organization. He is the director on nutrition and food safety. And we have a guest speaker from FAO who will talk about why food systems have so much to gain from whole grains in addressing pressing environmental challenges. In the panel discussions, our aim was to bring all the best practices from all around the world to bring some inspiration to other countries. And also we will touch base on whole grains' role in fighting COVID-19 pandemic and chronic diseases. We will also discuss evolving public policy initiatives on whole grain with the speakers from Denmark, from Latin America, and again from FAO. So what we can do to take immediate actions in order to promote whole grains, please check the Whole Grain Initiative platform to see all these amazing advocacy tools that can be very beneficial to set the same public-private partnerships or influence policies in UAE. We have a pledge under Whole Grain Initiative platform website. It's not a legally binding pledge, but it shows the good intentions that we are willing to make a change. So that would be great if you sign the pledge for whole grain promotion. Follow Eat Whole Grains on Twitter and Instagram. Now they kicked off the campaign for this November's International Whole Grain Day celebration, and you will see a lot of good messages. And that will be great if you can help us to spread the benefits of whole grain in your countries. And we are really looking forward to collaborating further with you and share this tools, best practices even further to take meaningful actions in order to make a good change, positive change in the nutrition and health status of UAE population. Thank you very much.
Thank you so much, Ms. AJ, for the wonderful presentation and informative information. I like the pledge, and also I look forward to participate in your upcoming event. We know most of the speaker. I saw the name of Philip Calder. He spoke one time here with us in one of the seminars, and he's a good researcher. So let's move to the panel discussion. We will have in the panel discussion, I will be the moderator, and Professor Nahla will be part of the discussion, panel discussion. Ms. EJ and Dr. Habiba Ali, the Associate Professor from the Nutrition and Health Department in the College of Health Sciences, Medicine and Health Sciences. And also we have Dr. Wafa Aish with us. So what we will do, if you don't mind, I will pose some question, and then I will assign this question to some of you. And then later on, we can see if our audience has any other specific question that they have prepared during your talk. My first question will go for Dr. Nahla, Dr. Habiba and Professor Nahla Hwalla. Here we have highlighted the importance of increasing the consumption of whole grain. But to be honest with you, many of the studies have shown that people, they are not adhering to the recommendation of whole grain consumption that were made by either WHO, FAO, or any of the UN agencies, or the science behind the importance and the benefits out of whole grain. In this regard, I would like Dr. Habiba and Professor Nahla to tell me what they think is the barrier for that hinder people from increasing their consumption to whole grain, specifically when it comes to our region or the United Arab Emirates.
Who do you want to start first?
Do you want me to start?
Sorry. Oh, I was talking and my
You were muted. You were muted.
I'm very sorry. Okay. Annie, I don't mind, really. I would like to hear the barriers at the level of the MENA region and at the level of UAE as a country. So I would like to hear from Dr. Habib if she thinks there is any barriers that affect the consumption of whole grain by the people here living in UAE.
Yeah, first of all, thank you, Professor Aisha. And also I would like to thank the organizers of the webinar. Yes, there are some barriers, and I think, can you hear me okay?
Yes.
Yeah. And I think one of the barriers, in my opinion, is the availability of whole grain food products, which are healthy, not only whole grain, but also are healthy. Because if you go and buy, for example, bread, you may find whole wheat bread or khubuz, but then it's loaded with sodium, for example. Okay. Also, we may find this whole grain product is sometimes a lot in the supermarket, but people do not know how to use it or how to use as a easy to prepare recipe, for example. So maybe, therefore, there's a need to have more of these healthy whole grain products available, not only in the main supermarket, but also in the neighborhood grocery stores. And there's a need for community education and awareness about how to integrate whole grain, not only from, the one comes from bread, but also other types of whole grain into easy to prepare recipes, which are also tasty. Because we know that convenience and taste are on the top of the list for consumers. So we then, as healthcare educators, it's our role then how we can promote this aspect of incorporating whole grain healthy food into diets of the public.
Professor Nahla, what about the barriers at the level of the MENA region? Is there any specific barriers that we did not hear about from Dr. Habiba?
Yeah, I first of all endorse what Dr. Habiba said. It's absolutely correct that the people don't know what is whole grains. They really don't understand it, and I want to thank Dr. Doro Khan for the really wonderful presentation and the journey that has started for whole grains. And there should be a journey, and there should be an agenda that is implemented on all levels in terms of education, in terms of, I cannot remove the hat of a researcher. So I'm going to put it back and say, we should learn what are the drivers of consumption, if they do consume or if they don't, and if you make it available. And also we have to take care of the fraud in the industry, where, as Dr. Doro Khan said, they might have like a small amount and the rest of it is sugar and salt. So would we be giving the right recommendation? So I think it's a journey. I think it's a strategy that has to be put together in order to address this very important issue, which, as you have seen, is on the top of the list for our predisposition to cardiovascular diseases and non-communicable diseases and obesity also.
Thank you, Professor Nahla. I agree totally with you and with Dr. Habiba. And I think now we need to shift our thinking. Instead of saying that white or refined, let's say, refined food can introduce or can increase the risk for non-communicable diseases. It's better to highlight the benefit out of everything good from our nutrient, either whole grain, nutrient consumption from fruits and vegetable, not skipping breakfast. So emphasizing the beneficial part of the nutrition instead of highlighting the negative part of it. I would like to go to EJ and ask her, based on what she has already shared with us in terms of the global practices and trends right now. What do you think? I have 3-in-1 for you, which means one question, but 3 sections. So what do you think, how we can promote whole grain intake, and how we can communicate it to the consumer? Is there any key food sources for to help us increasing our consumption to the whole grain?
Mm-hmm. No, I think dietary guidelines, national dietary guidelines, is a great starting point to address 2 questions: how much we need to consume whole grain and why we need to consume whole grain. In some cases, we don't see that clarity, and it's very difficult to translate some of the recommendations into consumer-friendly language. Even we are thrilled with the recommendation of 232 grams from Eat Lancet report on the consumption. This doesn't mean anything for consumers, unfortunately. How they will translate this 232 grams into daily life, daily consumption through products, even for us to make the calculation is sometimes challenging. So I think we need to find easier ways to really share how much people should consume and through which sources they can really meet the recommended intakes. And on the benefit side, as private sector, although we are really pushing hard to innovate and renovate with higher whole grain content in our products, it's not possible for us to communicate any health benefit because of the regulatory constraints. So again, nutritionists, dietitians, dietary guidelines are playing an important role to really share why people need to consume more whole grains, to talk about the health benefits, to talk about the benefits on the planet's health. So I think this is where the collaboration is quite important in order to create this awareness and to provide this guidance to people with the right amount of consumption. And the other vehicle is maybe front of pack labeling systems. Are we leveraging front of pack labeling systems well? Because they should be the vehicles to translate dietary intake recommendations into consumer-friendly language. Today, we are really focusing on the negative nutrients, but are we really putting enough focus on the positive nutrients, such as whole grains, in order to reflect what's written in there in the dietary guidelines? I think we can further leverage these logos, front of pack labeling systems further to embrace these positive ingredients, and the public-private partnerships for sure to drive awareness campaigns, education campaigns. It's very valuable in order to promote the intakes. Where we can find whole grains, we have great traditional sources like bulgur, whole wheat bread, breakfast cereals, popcorn, even popcorn. When you don't put a lot of salt and oil into popcorn, then it's a great source of whole grain. So it's not necessarily untasty. We are providing tasty products that can also contribute to whole grain intakes. I think this is a misperception that we need to overcome and educate people in the right direction.
Thank you so much, AJ. Now I would like to move to Wafa Aish. From what have you had in terms of example around the world on the whole grain practices? What do you think? What is your opinion? Who are the critical key player in a partnership to promote whole grain intake within a community?
First, thank you for all the speakers for their incredible outcomes and input in these lectures. It's amazing. Dr. Aisha, I feel you will be surprised maybe if I tell you that the mother is one of the key people because she's the one who cooks the food. We have to give her the easy recipes. They don't have recipes good enough for the whole grains. When they take the whole grains and they want to cook it, they don't know how much to soak it, how much time to be cooked. So we have to give them easy recipes that match our tradition in order. Like, for example, in Emirat, the haris is a very good source, and we do it very nicely. All Emiratis knows how to use it. And there was one question of how much. Like that 81 calorie, which is 100 grams, it's MLS. One serving, that serving spoon, you know. We have to give them utensils, which is easy also to calculate how much they need, because they might sometimes tell you that it causes obesity, which is not true if you know how much to be taken. So first target is the mothers, then the students. When we give them the education at school, nutrition is very important to target them when we give that, the science, and the nutrition is a very essential part. And when we educate them about the food plate, the healthy plate, and how to choose their plate, or the Burj Khalifa in Dubai, or whatever we use as a guide, we have to make sure that we have the tools to implement these tools on reality in our daily cooking. So that the mother is the main one, and then the schools or the university, I mean the students, whoever are, from the beginning. Because in children, also the mother is the key. But when they start adolescency and becoming an adult, they are their own decision. So we have two target groups that we have to really educate them about the importance of whole grain, of being healthy guts, and preventing of obesity, or preventing of communicable diseases, and all these things, and the relation of how to do them in a healthy way. And we have now so many varieties in all over the world of a nice way of doing the whole grain. In as our professor said, the popcorn, if you take it in a good way without no added butter and so on, it's a very good source of whole grains. So we have to give education, a good one, in sizes, portions, recipes, and of course for the parents and the students.
Thank you so much, Wafa. I think you have had an interesting outcomes out of Fit Kids study.
Yes.
We heard that most of our kids, they consume breakfast. We heard that almost the consumption of whole grain. Correct me if I'm wrong, Dr. Nahla. The whole grain is good. However, fiber.
No, the refined grain is good, but the whole grain is poor.
Whole grain is around 7%. Fiber also around, I think, 11 or so. So in this regard, Professor Nahla, Wafa, AJ, Dr. Habiba, what do you think? How we can best use these outcomes from a current study? How can we leverage and take out of this result a concrete action plan, especially when it comes to elevating the consumption of whole grain?
You know, I think, Aisha, I mentioned during my presentation, I could see from the results, the breakfast is a clear indication of where we can even now start interfering, because they do consume a lot of grains during breakfast, and it's the main meal where they consume the most grams of grains, but they are all refined grains. So providing alternatives to refined grains for breakfast, foods that can be consumed during breakfast, and advertising for it or educating for it would be great introduction to whole grains. So breakfast is an opportunity. I think we should take care. We should, take care of it.
And added to Dr. Nahla, in those which I totally agree, since we have that concrete data, thankfully, we can use them to maybe collaborate with the production, the tradings, companies, that to give us some recipes that helps them in having those whole grain, Dr. Nahla and dear panelists, in their breakfast in an easy way, because sometimes they don't know what to have that whole grains, and that's what the studies have shown. They think they have whole grains, and while it is not, and you saw it's only 7%. Which is, I believe we have to help them in guidance of recipes, I don't know, cooking sessions, I don't know, these things maybe.
You know, Aisha, there is something that we did not present, and we can look into it with you, is really the type of foods that kids or adolescents consume for breakfast. Not only whether it's whole grains or not, but what are these foods, and where from these foods we can select 1 or 2 or 3 to change and make them whole grains. This information I don't have now, but I think if we look, because we have this information in the study, is that what kind of foods those kids are consuming.
Okay. Any addition, EJ or Habiba? Because I would like to share with you my experience really in this regard. Yes.
Thank you. 1 minute or less, 30 seconds for me. I think I was going to say exactly what Professor Nahla just said. We need to look at what the kids eat for breakfast, because breakfast is the main source of whole grain. So we need, and they eat two things which are easy to change, which is bread and cereal. So we need to look for healthier options for those two. Thank you.
EJ?
Yeah, the consumption is concerningly low, but it also gives us reassurance that we are in the right direction. We are the breakfast provider, and we are really keen to increase our whole grain intakes. So it really gives us a great opportunity to make a change on the positive direction through breakfast cereals. Based on our experience in different countries, we translated this dietary intake research into very strong communication campaigns, also to educate moms on the importance of providing whole grain products to their kids. Some moms are really concerned to overload their kids with high fiber, although that's not the case. The intake levels are very far from the recommended levels. So we need to really emphasize that whole grain is beyond fiber, and the level of fiber they are taking is only beneficial for the health.
Thank you so much. You know, one of the intervention procedures that was done a long time when I was kid in UAE, they wanted to teach us the importance of breakfast meal. So what they used to do, they used to bring for us in our classes milk and fruit and a sandwich. This is just to educate us how important is the breakfast meal. So I think this approach can also be sought when we wanted to educate, especially the youth, not only the mothers. The mothers, they have a few years and already they adapted to a certain level of dietary habits. However, we should really emphasize such information into the youth generation. The kids, we should start doing the awareness at an early level. And such initiative providing cereals that has the requirement or the required amount of whole grain will be beneficial. Maybe this can be in collaboration with the Ministry of Education so that they can fund this initiative, or it can be done with some other approach. So this is one of the really moment that I cannot forget how the government has given us a free education. Even when they used to send us to the schools, by the end of the academic year, we will receive some money because they want to educate the family that for the importance of education for the girls here in UAE. So this is only my experience. But we have asked earlier, Wafa, about who is the major or key player in taking a concrete decision. We have different stakeholders. If we say government, what do you think it will pop into your mind? If we say academia, how do you think academia can play a role in such initiative? If we say private sector, pediatrician, community, each one of them, they can contribute to this approach, but in a different way. So it's just open for discussion. If you can contribute, maybe Professor Nahla, Dr. Habiba, they can contribute to academia. What do you think? How you think academia can contribute in taking concrete decisions? I think Wafa, your mic, there is something wrong with your mic. It gives
Really?
us echo. Huh?
Go ahead, Professor Nahla.
Professor Nahla.
Yes, can you? Yeah. Academia, as I told you, I think the roots are there, and the dedicated academic work would really bring solutions to local problems. And I go for the breakfast issues. For example, you want to give people. I know that there is an international market, and there are products that are produced for the international market, but there should be production for the local market, because people are used to certain ways of eating, and they are used to certain products that they eat. And of course, we eat a lot of refined grains. We eat a lot of bread. So I think the bread issue, the manouche, you can start there by having products like this. If I want to have a whole grain manouche, I cannot find. I will not be able to find. And this is like, I can say 75% of the people eat it for breakfast. I know that for the children in particular, the cereals is extremely important, and having a whole grain cereals and telling people this is the grain, the cereal that you should, and advocate it in your teaching, in your courses, in your talks to the public, in the public health ministry. All of this together can make an influence on consumption.
Can I add something? Maybe we have already proposed to have something like healthy curriculum, تربية صحية, that emphasize on the healthy lifestyle and healthy eating. Maybe it can be added as an academia to the Ministry of Education, because we have done already the canteen guidelines as departments, and Ministry of Health, Ministry of Education, all of that collaborate to have that. But still people doesn't follow the guidance. Maybe we can, as a health sector, pediatrician have to be educated more. It have to be given sessions about nutrition, to know how to give a healthy education for the parents who will, to emphasize to have a healthy plate, to educate them more about nutrition and healthy eating, for the pediatrician, because they are the also frontliners for the parents, Dr. Aisha. So
yes,
medically and educationally, we can do that.
Yes, you are right, Doctora. Thank you so much. Dr. Habiba, would you like to add anything for the angle of academia?
Yes, I think it was discussed very well by Professor Nahla. I would like to add that, in the university, of course, we do research and we have these findings, okay? And we often disseminate this in scientific community, but we also have to find a way in which we can make it simple, using simple language to disseminate these findings and share with the community. Secondly, we have a large number of students in our campus, and those students coming from different families, okay? So if we work maybe with the students to convey such message, and also, to their families, maybe this is a way we can reach more families through our students.
Yes, you are right, Doctora. There is a big importance in how to disseminate information from academia to public based on the on evidences, scientific evidences. AJ, how do you think that private sector can play a role in such, decision or action?
I have seen very valuable comments also on the chat. people are raising concerns around affordability, about the taste of whole grains. I think these 2 points are quite important. Like, our main responsibility is to provide affordable, tasty, and nutritious options. And this nutrition should go beyond whole grain. Of course, whole grain shouldn't be a compensation for high sugar, sodium, or fat products. So they need to go hand in hand. We need to focus on the right nutrient profiles while we are aiming to provide extra health benefits through whole grain. And I think this responsible approach is really required from industry side. And I'm really happy that we are taking these steps throughout our nutrition evolution journey along 18 years. But it takes 18 years. It's not something that you can come up with amazing nutritional profile overnight, because despite the comments, taste is the key. If you cannot provide a tasty product, then you don't have any opportunity to pass the healthiness of your products to anyone, because they won't buy it for the second time. So if we can build scale with this public-private partnerships, if we can generate demand, then the demand for whole grain options will increase, and this will lead to more affordable whole grain products as well. It's kind of chicken and egg. And we are here to support this communication campaigns as well, but it needs to be in collaboration.
Of course. And this is where I wanted to really conclude this session by saying there is a great need for multi-component intervention and multi-sectorial collaboration, especially when it comes to addressing policy. So we need not necessarily to generate a new policy, however, to modify the current policies, also to try and find smart solution and maybe initiate new services and try to establish behavior change initiatives that are adapted to the current era. It's not outdated. It meets the Z generation mind. Also, it can be adapted to different culture. So this is where we stand. And thank you so much once again. It was an interesting, and I wanted to really to highlight Nada question from the audience who said that whole grain are expensive. So how do you think people will be convinced to consume whole grain, especially in countries with bad economical status? So I think coming up with different initiative, different approach, maybe using what other culture, maybe the available stable food, and modifying their like in for the private sector, you can for sure easily do a reformulation for some of your product and enhance the good nutrient in them. I will leave the floor here. Maybe AG, if you want to contribute, or Dr. Nahla, Dr. Habiba, and Wafa to the end remarks, I will be happy to hear from you.
There is one great example from Singapore that might be really inspirational. In Singapore, government incentivized brown rice over white rice. And such an established traditional habit that it's very difficult to move people from white rice to brown rice in Asian culture. And with this government support to make brown rice more affordable than its alternative, they significantly increase the consumption. So similar actions can be taken in different countries to really via incentivizing these whole grain options rather than penalizing the refined versions.
Thank you so much. Dr. Nahla, last comment?
I really wrote it on, I think without policy interventions, policy can move the agenda forward. And And like Ichi said, that policy from the government to subsidize whole wheat products, or it's not the food, it's the product that you bring into the country in order to make the food, that will make the industry move to that direction and maybe help propagate the consumption of those products.
Thank you so much, Professor Nahla. Dr. Habiba or Ms. Wafa, would you like to say something?
Thank you very much. All of those are, I think, excellent suggestions. It was mentioned before by ACG, the idea of having a whole grain stamp on food that will make consumers find food which are whole grain. So I think that will be very useful also to consider as part of the policy, like food labeling.
Yeah, thank you, Doctora. Dr. Wafa?
I just want to say, yes, when I was looking to put the guidelines, I really didn't find any policies that emphasize how to use the whole grain and all these things. So I totally agree that we have we have a guidelines, but we have to implement them. We have to make sure that there's a policy, there is a tool to check that we are doing it right. And again, education, it should be a must, and collaboration between all the private sector as well as the government. Thank you.
We should not also forget about the parents. We need to help them in making their healthy journey easier. We need to give them support. When I think about whole grain, I think I recall three multi-component, multi-sectorial, especially when it comes to decision, action, intervention, and multi-support. The support should be given to the families, should be from the healthcare professionals, from educators like academia, from private sector, and from government. Thank you so much for the interactive and nice session. I would like to end by thanking Nestle Nestle Middle East for their support to this webinar. If you don't mind, can we take a nice and lovely photo? Yeah, I don't know if
كنا سوينا شعرنا.
شعرك مساوي يا حب. حلو شعرك يا دكتورة. I don't know if AJ you understand Arabic. Turkey is similar to Arabic.
No, not Turkish. No.
It's not Turkish?
No, it's not similar.
Okay.
Okay.
Yeah. No.
I was saying I could have gone to the hairdresser if I knew there was a picture.
Yeah. I think Leila here, she arrived, so I have to give her some space from my beautiful camera. I don't know why she is sharing. Okay, Kim, you can take photo.
Okay, doctors, please see on your camera on count of 3. 1, 2, 3, smile. Okay, thank you so much.
Thank you so much. All the best. Thank you. Thank you. Have a great evening. Bye-bye.
Thank you, Aisha. Thank you very much.
Thank
That
you,
was wonderful.
دكتورة.
يعطيك العافية. ما شاء
الله
الله.
يعافيك. الله يسعدك يا رب. See you soon, دكتورة.
Inshallah, we will be
In
seeing.
nutrition conference.
Bye-bye.
Bye-bye, Jay. Bye-bye.